Welcome to Tidbit Tuesday. I'm Ashley Avery with Tri-Strand Therapy Services. We are an applied behavior analysis provider in the Dallas area. Last week we talked about what is applied behavior analysis. This week I want to share information on getting a diagnostic evaluation, which is required to qualify for ABA services through your commercial insurance or Medicaid plan. Although ABA is an effective treatment for many different populations, at this point, applied behavior analysis services are typically only covered by insurance for those with a diagnosis of autism. Those of us in the field will keep fighting legislation for this to change, but for now, we're grateful to serve those with a diagnosis of autism, and that's what we're going to focus on today. In seeking out a diagnostic evaluation, there are a few questions that need to be answered in order to know which direction to head. We have included a chart on this information discussed for you to follow along. The first question is the reason for seeking the diagnosis. The second is who's paying for the evaluation and the treatment. Let's assume that the answer to question number one, the reason for seeking a diagnostic evaluation, is that you see that your child needs help in school, at home, in the community, or all of the above. Or maybe you don't know what they need. Or maybe you're wanting to pursue applied behavior analysis therapy. Which leads us to our second question, who is paying for the evaluation and the treatment? We're going to look at school district, commercial insurance, and Medicaid funded services. If you are considering getting a diagnostic evaluation through your local school district or already have this type of diagnosis for your child, it's important to note that a school diagnosis is not an official medical diagnosis and does not necessarily qualify your child to receive ABA paid for by insurance or Medicaid. Let me explain why. A school diagnostic evaluation is paid for by the school district and is used to assess whether a student qualifies for school accommodations and therapies, and although it can include some of the same information as a medical diagnosis, it is not an official diagnosis of autism or viewed as one by commercial insurance or Medicaid. Simply put, if you're looking for ABA services for your child through Medicaid and most commercial insurance plans, you will need an official diagnostic evaluation administered by a diagnosing physician. This includes PhD, a Psych D, or MD. To find a diagnosing physician in your area that accepts your plan, we suggest reaching out to your insurance provider for a list of those. Know that advocating for your child is a lifelong marathon, not a sprint, so be prepared that due to demand, you may be waiting months for an evaluation appointment. Early intervention is crucial, so if you're considering moving forward with a diagnostic evaluation for your child, the time is now. If you are located in the North Dallas area, feel free to reach out to us about child-specific questions or visit us at tristrandtherapy.com. See you next week for another installment of Tidbit Tuesday.